Most of us want straight teeth, and if you're an adult, you likely want to get there without a mouthful of metal. That desire has turned these molded, nearly invisible plastic trays into the most requested orthodontic treatment in Muscat today. Fixing a stubborn gap or a shifted bite is a multi-year physical commitment. Clear aligner systems take a digital approach. Your dentist uses a 3D scan of your mouth to create a series of custom-fitted plastic trays, each designed to gently nudge your teeth toward their final position. Choosing based on aesthetics ignores day-to-day reality. You must weigh two different types of friction. Traditional braces create physical friction, managing cheek irritation and dietary limits while the hardware does the work. Aligners create behavioral friction. Your progress depends entirely on daily discipline. You have to determine which you handle better, the constant physical presence of wires or the strict mental load of managing a removable routine. This chart shows the primary rule of clear aligner treatment. To be effective, the trays must stay in your mouth for 20 to 22 hours every single day. That leaves a very narrow 2-hour window for all your eating, drinking, and brushing. Leaving the trays out for too long stops the movement of your teeth. This causes your digital treatment timeline to stall or drift off track. Metal braces avoid this vulnerability. They apply continuous pressure 24/7, operating reliably without any intervention from the patient. By choosing fixed hardware, you essentially outsource the discipline of the treatment to your orthodontist and the brackets themselves. New patients often assume that a high pain tolerance will help them finish an aligner plan faster. In reality, consistency is the only metric that guarantees a case finishes on time. The most expensive technology in the world won't work if the trays are sitting in a drawer. Aligners are often marketed as having zero food restrictions. You can still eat apples, corn on the cob, or sticky sweets because the trays come out during meals. However, this freedom creates a hidden daily workload. You must brush and floss after every single snack or coffee break before you reinsert the trays. This diagram illustrates the biological risk. If you skip brushing, these plastic trays hold sugar and acid directly against your enamel for hours. This raises the risk of tooth decay significantly compared to eating normally. This also prevents you from casually sipping tea or coffee throughout the day. Pigmented drinks will stain the plastic, making your invisible trays highly noticeable. On the plus side, smooth plastic is much more comfortable than metal. You won't have to deal with wires poking or scratching the inside of your mouth. But the plastic is fragile in Oman's heat. If left on a sunlit car dashboard, the tray can warp in minutes, throwing off the precise fit your treatment plan depends on. Losing or warping a tray leads to emergency clinic visits and timeline delays that can add months to your treatment. Removability is a major benefit, but it demands an exhausting level of awareness regarding your hygiene and your environment. Both systems move teeth using different mechanical principles. Braces pull teeth into position using wire tension, while aligners use plastic to push them. Clear aligners excel at treating mild to moderate crowding, or closing small gaps. This graphic shows the limitations of plastic. A fixed metal bracket provides multi-directional pulling leverage. A plastic tray, even with temporary attachments, is limited to a localized pushing force. Severe jaw discrepancies, extreme overbites, or teeth that need significant rotation often require the mechanical leverage that only traditional hardware can provide. Your clinical biology ultimately determines your eligibility. If your bite is severely misaligned, your dentist will likely recommend traditional braces regardless of your lifestyle preferences. This decision tree helps select a treatment path by focusing on your actual habits. We start with the severe case. If a 3D scan shows complex bite issues, you route directly to traditional braces. Clinical requirements override all other factors. Next is the convenience seeker. This patient frequently misplaces items, enjoys sipping coffee throughout the day, and struggles with rigid routines. Traditional braces are the safest investment for this profile. Fixed hardware guarantees results by removing the need for daily self-discipline. Finally, we have the disciplined professional. This patient needs discreet treatment for work and has the discipline to brush after every meal. Clear aligners are the ultimate choice for this regimented lifestyle. The system works because it fits into habits they already possess. No matter which route you choose, the end game is the same: You will need to wear a retainer at night long-term to protect your results and keep your teeth from drifting back. Pick the system whose daily frictions you are actually willing to manage for the next 2 years. That is the only way to ensure you reach the smile you're looking for.